Israeli media is reporting forces are being mobilized and refugee tents are going up in preparation for Israel to enter Gaza's southern city of Rafah.
Aid groups warn an invasion into that city would create what they describe as an apocalyptic situation. The World Food Programme, meantime, is warning that Gaza could surpass all three famine thresholds. That's food insecurity, malnutrition, and mortality in just 6 weeks. For months, the UN has been accusing Israel of creating obstacles for getting aid in and distributing it throughout Gaza. Israel denies those accusations and blames agencies for insufficient distribution.
Meanwhile, the United Nations is calling for an independent probe over reports of mass graves found at Gaza's two biggest hospitals. The Human Rights Office says some of the bodies found allegedly had their hands bound and were stripped of clothing. To talk more about the healthcare crisis in Gaza, Dr. Aman Odeh is with us now. Dr. Odeh, thank you for being here. You recently participated in a medical mission in Gaza. You were involved in the neonatal ICU. Talk to us about that experience and what you saw.
I did not expect to get a text message saying we need a pediatrician in Gaza. This is not usually the usual in a war zone situation. But we found ourselves in an area where babies are dying for lack of resources. The very second day that I was there, after I was introduced to the NICU, I was called to delivery, went in with one of the local doctors. The mother has been waiting for several hours for her turn at a C-section after she came in bleeding. The baby was born with barely any pulse, looked like had bruising all over, and we had to just hold the baby's hand while the baby died because we only had the one ventilator available for us. That the local doctor looked at me with teary eyes saying, we only have this functioning ventilator. This baby has a very low chance of survival. We have to use it for a baby who might have a better outcome. This was my introduction into Gaza. And these are the NICU babies where these are supposed to be protected.
Dr. Odeh, we're seeing...
So this was...
No, please continue.
Yes. And the horrific part is we don't even have time to grieve. We don't have time to talk to the families. I have to move on to the next patient and the next, and the one after. You're taking care of neonatal premature babies who are 3 to 4 in one incubator, no nutrition, no labs. I could not even order labs to make sure that is there an infection? Is there an electrolyte imbalance? Is there if the baby was on a ventilator, we had no way of knowing that we're doing a good job with the ventilator other than looking at the baby. It was a horrific, overwhelming scene that we had to encounter every day over there.
And Dr. Odeh, as you say, there's not even time to grieve. We're looking at these images of kids and babies suffering. I know you had time to visit some of the refugee camps. You know, the UN is warning we're 6 weeks away now from hitting all these famine thresholds. What's happening at the camps that you saw?
We were able to have a site visit at the refugee camp. It's children everywhere. There are makeshift tents because we also found out that many people don't even have tents. They have to just find these plastic bags and put up wood posts and put tents together for themselves and for their families. The hygiene situation is dire. There are no bathrooms. They have to dig holes in the ground is what they were telling us. And this video actually shows, this is the Salahuddin Street, and this is a little bit northern part of Gaza. And this video here is from our apartment building. And you see how dense this population, and then you look at this area, the building next to our building was completely destroyed. There is no clean water. You wash your face with salt water. You shower once a week if you got lucky. The children are the ones that are suffering. It is the children. More than 50% of the population is children. We were also able to visit Shuhada al-Aqsa Hospital. The moment you enter that hospital, it is people everywhere. You have in every inch of the hospital, there are people living there, in addition to the patients that just come in and are thrown on the ground for you to take care of with the very basic supplies. You're basically putting Band-Aids on dying people. And the worst part is, again, you don't have time to grieve. A father brought in his 3-day-old, put him on one of the broken warmers, with tears in his eyes, and he looked at us. He's like, "Please help him." And I couldn't do anything. The baby was already dead.
Oh,
I looked around. I could not find a place for him to sit down and grieve. I turned around, looked for a chair. I couldn't find one. I looked back, and he was already gone. He had taken his baby to bury him.
oh.
So the healthcare workers over there are absolute heroes. Like, I could not find words to describe what they do day in
Yeah.
and day out.
Dr. Aman Odeh, with your firsthand look at the situation there in Gaza and what you experienced, thank you.
Thank you, Doctor.
Yeah.